Feeling your child's forehead and realizing it feels warm can instantly trigger a wave of concern for any parent, leaving you to wonder if it is just a little heat or something more serious. It is a common moment of uncertainty, especially when your little one just does not seem themselves. And knowing exactly what that warm feeling means is the first step toward understanding how to help them. For children, a temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius, taken rectally, orally, or in the ear, is generally considered a fever. This specific number acts as a clear indicator, helping parents and caregivers quickly identify when their child's body is actively fighting off an illness, signaling a need for closer attention and care. A fever is not an illness itself, but rather a sign that your child's immune system is doing its job. When the body detects an infection, it releases chemicals called pyrogens that tell the brain to reset the body's internal thermostat to a higher temperature. This elevated heat helps to slow down the reproduction of viruses and bacteria, making it harder for them to thrive, and it also boosts the activity of white blood cells that fight infection. So, a fever is essentially your child's natural defense mechanism kicking into high gear. To accurately check your child's temperature, a digital thermometer is your best friend. For infants and very young children, a rectal temperature is often the most reliable, while oral or ear thermometers can be effective for older children who can cooperate. Always make sure to follow the specific instructions for your thermometer and sanitize it thoroughly before and after each use to ensure both accuracy and hygiene. Understanding what constitutes a fever helps you focus on how your child is acting rather than solely on the number. A child with 100.4 degree Fahrenheit temperature who is still playful and drinking fluids might need different care than a child with a slightly lower temperature who is lethargic and irritable. Fever medications can certainly help reduce discomfort, but the underlying cause and your child's overall demeanor are key. By understanding the specific temperature that defines a fever and why their body responds this way, you gain the confidence to react appropriately. This knowledge empowers you to provide thoughtful care, knowing you are supporting your child's natural healing process while recognizing when it is time to seek professional medical advice, ensuring their comfort and well-being.